This series was birthed from the desire to create a complimentary, safe space to openly discuss health issues that impact Black women and the disparities within the medical industry that many of us encounter. Last week, our expert, Dr. Janet Williams, led an enlightening conversation surrounding what we need to know at every age. Tonight, she will lead us through a highly anticipated discussion about common issues and solutions. We thank you for joining us, and we look forward to tonight's dialogue. I present to you Sister Katina, who will introduce our expert.
Good evening, everyone. It is my pleasure to introduce Dr. Janet Williams. Dr. Janet is a board-certified obstetrician and gynecologist, a specialist in sexual medicine, and an unwavering advocate for women's health. With over 25 years of experience, she has helped countless women navigate reproductive and sexual health challenges, guiding them towards confidence and well-being. Beyond her medical practice, Dr. Janet is also an intimate life coach and hypnotherapist with goodgroove.com. She offers virtual coaching and hypnosis programs tailored to women's unique needs. She's the author of an Amazon best-selling book, Why Don't I Like Sex Anymore? A Grown Woman's Guide to Getting Your Groove Back and Reclaiming Your Truth. Her passion for this work is deeply personal. Like many Black women, Dr. Janet faced challenges balancing career, relationships, and health in her early 40s. She endured a difficult fertility journey, that tested her confidence and intimate life. But through therapy, coaching, hypnosis, and her medical expertise, she has not only healed but rediscovered pleasure in ways she never imagined. Today, Dr. Janet channels her experience into helping midlife women reclaim their confidence, master their perimenopause and menopause journeys, and embrace their own brand of pleasure. Whether through coaching, her confident pleasure course, or digital tools like the Hot Flash Chill system, she is committed to ensuring that every woman, regardless of their age, race, or background, has the power to determine and define her own sexual and personal fulfillment. Please join me in welcoming Dr. Janet Williams.
Hello, everyone. I hope you all are doing well. It is wonderful to be here with you all today. Today, we're going to get into some of the nitty gritty. In the last session, we talked a lot about what menopause is, what perimenopause is, and what that transition is all about. I am going to jump into some of the healing options, the treatment options, some things that we can actually do to improve the transition. And we'll talk about some of the most common problems that we see arising in menopause, and we'll get into some of the specifics. Now, I've got to say that I am very biased. The things that I work with my clients with and the things that I've used for my treatment options may differ from a lot of other people, but I definitely believe in the biopsychosocial model for approaching menopause and as well as our sexual health. And so, with the biopsychosocial model, we're dealing with the physical attributes, the physiology, the anatomy. All of these things are the biology, and then the psychology is, what's going on in the brain, what's going on in your mind, how are you processing these things, and how is it manifesting in our behavior. And then finally, the social part is this community and what the way that we think about things in the world, the way our upbringing impacts us, the way our upbringing and our social connections influence our behavior and the way that we process things and move through menopause. And so I'm going to talk about all of the things that are backed by research, including some of the mind body practices, including hypnosis. So we'll really be able to dive into things that will actually help you. Now, there's a lot to cover, and we probably aren't going to be able to get to all of the different types of treatments and different types of approaches. But just know that there is no one size fits all. That's another part of this. There is no one size fits all. And you can take a little bit from here, you can take a little bit from there, and you can pull it all together to make something that works for you. So I want you guys to go ahead and drop in the comments some of the things that you'd like to see and like to hear about today, what you'd like to get out of the session today. Are there any symptoms that you're having, any difficulties that you are dealing with right now in terms of perimenopause, menopause, and what you want to see happen? Go ahead and drop those comments in there. Let me see what you guys are dealing with. Anyone? Okay. All right. Well, mood swings, belly fat, brain fog, ways to combat brain fog, hyperpigmentation. Okay, that's another one. Okay. Anything else? Night sweats, sex drive, belly weight. Belly weight. I've got a lot of menopause. Weight gain. Okay. All right. So we will jump into that. I'm going to go ahead and share my screen here. Okay, so we are day 2, and we're talking about transforming those annoying symptoms into refreshed energy. Okay, so the most common symptoms that we're going to be seeing with menopause and perimenopause are hot flashes, sleep disturbances, weight gain changes, and changes in the body shape. This is where we're talking about that abdominal belly fat that happens, vaginal dryness, sexual dysfunction, brain fog, sort of like the series of brain, mind, mental things, mood changes, cognitive changes, and changes in skin and hair, where we're seeing some of that hyperpigmentation that somebody mentioned. And so why is it important to address these things? So it's important because this really affects our quality of life. And a lot of people think, okay, I'm just going to power through and, I've got these hot flashes or whatever, it's just going to pass. But it's really, it may last a long time. So for most women, we see that the transition happens over a year or so, but that we can have like pretty intense symptoms and hot flashes and problems that last for up to 10 years. So we want to get these symptoms under control so we have a good quality of life. The other thing is, like, when we're not addressing these issues, especially when we're talking about hot flashes and we're talking about night sweats, that is the time that our body uses to heal. And then estrogen is an anti-inflammatory. And so if we've got more inflammation, the estrogen is low, the inflammation goes up, our body is not having the time to heal and recover from the things that are normal stresses up until this point. And so when we're having poor sleep, there's less healing and there's more illness. And so we really do want to address these symptoms. So I want to talk about some of the sources of estrogen. And as we talked about before, estrogen is the key hormone that we have in menopause that goes down. And so the sources are from the ovaries primarily, and those sources, they drop down. But there is some estrogen coming from the adrenal glands. And so the adrenal glands are those little glands, or like a little cap on the kidneys, in the area of the kidneys. There's also a little bit of estrogen that is in the fat cells in our bodies. So we've got a little estrogen there, and that is turned from one type of hormone into estrogen, but it's very minimal in the fat cells that we have. And so I want to get into hot flashes a little bit, okay? Because the hot flashes are probably the most common thing that we see women have. About 80% of women will encounter hot flashes and at some point in their menopausal journey. And so they can be extremely disruptive. And I want to talk about the mechanism of the underlying mechanism of how these hot flashes are occurring and what's going on in your body. so that you understand how the treatment options work. Okay. And so, like we discussed before, the estrogen is this hormone that is so vital in all these different parts of our body and our physiology. And with the hot flashes, the brain, there's an area in the brain called the hypothalamus. And this area of the brain uh, performs as a thermostat. And so when those estrogen levels go down, the thermostat gets thrown off. And the brain, when there are slight changes, very slight changes in temperature, your body perceives that as a large change. And the brain mistakes that change and signals the rest of the body and tells the body to cool off. And so that estrogen is not there, the hypothalamus overreacts, and we see the response of the body occurring. So we're getting increased heart rate, which causes the blood to pump to the periphery or to your extremities, and that helps to release it helps to release the perspiration. And so you get this sudden, feeling of being extremely hot, you're sweating. This can wake you up from sleep, and your body responds in that way. And so, how long does this last? We kind of mentioned this before, but the hot flash itself, they generally will last for about a minute. And they can last, for up to 10 minutes. And you can have moderate, and mild, moderate, and severe. And about 20% of women have very severe hot flashes where they're getting multiple hot flashes throughout the day, up to 20 hot flashes that can really be disruptive. And so that's the time. In terms of the timeline, for Black women, we have a much, much longer timeline with these hot flashes. I have a theory about that, and I believe that it is associated to higher stress levels. We've got microaggressions at work, racism that we're dealing with, crazy stuff going on in the administration, and all of these things impact us and carry a longer course. And going back to the adrenal glands. So another thing that the adrenal glands do is to produce stress hormones. And so if the estrogen from the ovaries is completely gone or very, very low in menopause, and the other source for the production of estrogen is those adrenal glands. If those adrenal glands are busy in fight or flight, and they're busy creating cortisol and other stress hormones, they're not going to be able to produce the estrogen. And my theory is that if you have chronic stress, be that, the stress of being a Black woman in America, or whatever the stress may be. A lot of times during this time period, we're doing multiple things. We're caring for aging parents. We're taking care of kids. We're graduating kids. We're empty nesting. Like there's a lot of, different stressful things that are going on at this time. You throw being a Black woman in America on top of that, and you've got a recipe for chronic fight or flight stress. And that's my theory is as to why, why this lasts so much longer for us. Up to 10 years for Black women, Latina women, 8.9, white women, 6.5, and Asian women are 5. So how do we treat hot flashes? So there's a number of things. So we've got hormone therapy, which is the gold standard for therapy and treatment. Antidepressant medications, hypnosis. I'm a fan of that. Herbal preparations, and something called stellate ganglion block. Now, all of these are things that are approved by the Menopause Society, and supported by ACOG, which is the American College of Obstetrics and Gynecology. So these are things that are backed by research. They have studies behind them that say that they work. Okay. In terms of some of the other things that are not on this list, they may work, but we don't have, studies on it. Now the herbal preparations that I'm going to mention are actually going to be mainly the ones that we don't recommend, or that they work, but we don't necessarily use them. We'll get into that. So these are the solutions. So in terms of hormone therapy, therapy, when we talk about hot flashes, they consist of estrogen systemically. And I want to kind of tell you what systemic estrogen is: estrogen that floats through your bloodstream, okay, as opposed to local estrogen. So for hot flashes, you need systemic estrogen. Okay. And so the estrogen is going to be the thing that helps with the hot flashes. And for most women who have a uterus and have not had a hysterectomy, we pair that estrogen with a progesterone. And the estrogen helps to, improve the hot flashes. The progesterone is used to protect the lining of the uterus. And so any woman who has a uterus in place and is on systemic hormones will need both an estrogen and a progesterone. And so who can use hormonal therapy? So there's a lot of questions out there about why can we use hormonal therapy? Is it dangerous? Does it cause breast cancer? I mean, is it going to cause me to have a stroke? Can I use it or not? And there's a lot of confusion around that. The reason for that confusion stems from a study that was done back in, the changes that came out back in 2001, right? So it was called the Women's Health Initiative. And so in this study, they looked at thousands of women. And when they were studying it, they were looking at trying to see the effects on the heart and how it would improve the heart health. And as they were going through the study results began to show that it actually increased the risk of heart disease and increased the risk of breast disease or breast cancer. And so everyone took everybody off of hormone therapy. It was just like, it just dropped down. And women who were, thriving on hormone therapy were removed from it and suddenly plummeted down and didn't have any therapy. And so people were scared. So doctors were scared, patients were scared, everyone was scared and stopped using hormone therapy for the most part. And so we're seeing a revolution back again. And we realized that the way that they were looking at the research was wrong. And what we now know is that hormone therapy is actually pretty safe for just about everybody. The two groups of people that we don't want to use hormone therapy in are people who have estrogen sensitive breast cancer, people who have cardiovascular risk. And so that basically includes anyone who has a heart attack, stroke history, certain people with blood pressure problems, a history of deep vein thrombosis or blood clots that form in the legs, and then a personal history of thromboembolic disease. So that is a disease that causes your blood to clot more than it should. And so those are the group of people who really can't use hormonal therapy kind of across the board. Okay. Now, like I said before, everyone's different, and you do need to have these conversations with your clinician, with your doctor, in order to see what works well for you. But by and large, that group of people are not candidates for hormone therapy. And the reason why is because with systemic estrogen, there is a slightly increased risk of blood clots and making the blood kind of thicker. And so if you have any of those baseline risk factors, we don't want to put that additional risk factor on top of it. Okay. So another thing that we want to look at when we're talking about systemic hormone therapy is the age at when we start it. And so for people who have recently gone through menopause, we want to get that started right away. And the reason for that is because as we age, our blood vessels without estrogen have inflammation. And that inflammation can lead to atherosclerosis, or like the hardening of the arteries. And with atherosclerosis, and then again, we put on top of it the estrogen, which is slightly thrombogenic, or meaning you have a higher likelihood of having a blood clot. If you've gone for more than 10 years past menopause, the likelihood of you having atherosclerosis is increased. And so we want to get that estrogen started in the first 10 years after menopause. And for women over 60, we generally don't recommend starting estrogen, if you're not already on it. Now, if you are in your 60s and you've already been on estrogen, a lot of times, you'll have the discussion with your clinician and you may continue it. But again, this is, not across the board. We've got to look at each person individually to kind of figure out what works well for them. So those are the people who can and cannot use hormone therapy. Before I go forward, I want to just talk about the different modes of delivery. So you can take estrogen pill orally, so you can take it by mouth. When you take it by mouth, that does increase the risk of clotting. And so for most people, when we start a hormone therapy regimen, we're going to use a patch, and we're also going to use the progesterone pill. So when you have those conversations with your doctor, that's what you want to kind of discuss. Okay, so then antidepressants. So antidepressants, we've got a lot of information. We've got a lot of research on antidepressants, and they work again by working in the brain with those neurotransmitters to change the level of serotonin. And so what serotonin is, it's a chemical that helps to regulate our mood. And when serotonin dips, and when the estrogen dips, we see a serotonin dip as well. So when the serotonin dips, it can confuse that part of our brain that controls the heat, and it then leads to the hot flashes. And so we can use the selective serotonin reuptake inhibitors, it's called SSRIs, and those can help with the hot flashes. And like I said, we've got lots of studies on those, and we're talking about things like Paxil. And just a heads up on Paxil for anyone who has had breast cancer and is on tamoxifen. You shouldn't actually take SSRIs like Paxil because they can interfere with the way that tamoxifen works. So just a little sidebar. Other antidepressants that we can use are Lexapro and Celexa. One of the really works pretty well is something called Effexor. Does have a lot of side effects, so probably not the ideal option. So the thing with the antidepressants is that they often can cause a lot of side effects. So a lot of these SSRIs can cause sexual dysfunction, changes in libido, sleep. They can affect sleep. So again, this is another area where we have to kind of individualize it for each person, because you can't just across the board. There's some side effects that may work for somebody, like somebody who's having sleep issues may want to have an SSRI that helps them, sleep or makes them a little bit tired. And so we kind of see what your symptoms are and kind of figure out what will work for you. Okay, so that is the antidepressants. So one thing that I love to talk about is hypnosis. So hypnosis is a great option for just about everyone. I created a program called the Hot Flash Chill System, which is an educational digital course. And in addition to the digital course, are hypnosis audios. And what hypnosis is, it's basically a way of getting your mind into a very relaxed state of mind and focused. And so what we can do, we can actually access the autonomic nervous system. So there's like three different areas of the brain. So there's the conscious mind, where we're talking right now. You might be taking some notes. You're thinking about what I'm saying. I'm thinking about what I'm saying. And we're having a like conscious discussion, right? Um, and then you've got the subconscious mind. And the subconscious mind is where all of our memories live, where our behavior lives, and it sort of communicates with our unconscious mind. So the unconscious mind is connected to our autonomic nervous system, like our stomach, food digesting, the blood pressure going up, things that respond to our emotional state. So like if you went outside and there was a dog growling outside baring their teeth, you would, get scared, your body would move into action, your um, fight or flight system would kick into gear, and you would respond, right? You'd run or close the door, whatever, in response to that like stressful situation. And so we can use that natural system to our advantage to do things like decrease our blood pressure, to change behavior. A lot of things that are stuck in our subconscious mind can be adjusted. And so that's one of the wonderful things about hypnosis, that we can use it to actually reset the brain and reset the thermostat with hypnosis over time. And hypnosis is natural. So if you've ever been in a car and you're driving and you're on your way to work or you're on your way to school, whatever, and you suddenly are at school or you're at your job and you don't remember how you got there, that is a state of hypnosis. So that is a natural thing. And we actually have hard evidence, hard research that shows that hypnosis decreases hot flashes in up to 80% of women who use it. And so there's a number of studies that support the use of it. It works on most people. It's safe. We actually we've been using hypnosis for years, since the 1950s, supported by the American Medical Association, used for anesthesia, and it works for hot flashes. It is consensual. A lot of people think that that hypnosis is like mind control. You've seen them waving the little pendant across, and people on stages barking like dogs and chickens and stuff like that. That's stage hypnosis, but it's actually a consensual state of being, and you have to do it with your hypnotherapist in order for you to actually be in hypnosis. One of the reasons why before we go forward with that, one of the reasons why I actually created the hot flash chill system was with Black women in mind. As I mentioned before, we are more likely to have hot flashes for a longer period of time. And so it is essential that we have something to, treat that. And we're also have a higher likelihood of having breast cancer. We have a higher incidence of cardiovascular disease. And so I wanted to provide an option that was safe, natural, that everyone can use. And often we're using it while we're figuring out what the best treatment option is for us. So you can use it together. You can actually, sometimes people will have hormone therapy that they're using that it actually doesn't cover all of the hot flashes. You have a little breakthrough hot flashes. So it's a great option to, connect together, and can be used for aiding in sleep and, aiding with mood, aiding with anxiety. There's lots of studies that support hypnosis for that use as well. So that's the reason why I created this system. Okay, so let's talk about sleep. Sleep is one of those things that is really interfered with, even if you're not having hot flashes. There's a lot of women who are having those night sweats, or waking up in the middle of the night and they're soaked and drenched in sleep and in sweat and can't get back to sleep. Is any of you guys any of you all having those problems? And drop those in the comments if you're having any sleep issues. Let's see, we see a couple here. We got, yes, night sweats. Yes. Yeah, the funny thing about that is too, it's like you may not even have night sweats. You might just pop up at 3 o'clock in the morning or 4 o'clock in the morning. There was a time period where I was waking up exactly at like 3:33. It was the craziest thing. I would just wake up and I'm like, yep, it's 3:33. And this is before I was even having hot flashes. And then I could not see, yeah, Phyllis, 4 a.m., just like boom, waking up. And so there are a lot of sleep disruptions that are happening in this time, and they're hormonally related. There's also, on the lines of brain fog, there's actually changes in the nerve tissue in our brains when we go through menopause. Menopause it's sort of like in the brain, it's sort of rewiring the function of your cycle, because you're no longer trying to reproduce. Like before your cycle's in, the body is like, okay, we're going to reproduce. That's the whole purpose of the cycle. And so in the menopausal transition, your brain is sort of like rewiring itself. And a part of the fallout is the brain fog and some of the sleep issues that we're seeing. Yep, 3 a.m. wake up. Yep, like clockwork, right? And so for the sleep, this is another one of those multi-prong approaches. So we want to, take a approach where we're looking at a number of things. Okay. And so let me close that up. So again, the hormonal therapy is going to be helpful. If you're a candidate, I love hypnosis, but if you're a candidate for hormone therapy, use it. Like it's a good thing. I prescribe it every day. I've got a patch on. I use my hypnosis. I do them together because it works together. So hormone therapy is going to help for that. Help with the hot flashes. And then the progesterone, when we're using that micronized progesterone along with the estrogen, it actually does aid with sleep. So those two things together can really help to improve your sleep. So if you're able to, talk to your doctor about it and see if you are, in fact, a candidate for hormone therapy. In the hot flash chill system, I also have a coaching blueprint where you're able to kind of go through and see if you are a candidate for hormone therapy. And you can also go through and see what other options might work for you. You can put that all together and take that and talk to your doctor about it and see, you already have something that you say, hey, these are the things that I've looked into and these are the things that will work for me or that I would like to, consider using. So hormone therapy, other pharmaceuticals. So, there's sleeping aids, some of the antidepressant medications, those SSRIs have a secondary side effect of making you sleepy. So some of those may be options. Magnesium, oh, I have an extra line there. Magnesium is a great element that a lot of people aren't using enough of. We'll talk about that there. And then sleep hygiene. There's some important things that we can do for sleep hygiene that can help us to get to sleep and stay asleep. Okay, so let's see here. Sunlight in the morning and sunset in the evening. This is a kind of cool thing that the optic nerve, when the optic nerve sees the sun in the morning, it tells the body to wake up. It is a cascade of hormones and neurotransmitters that make you wake up. And the same thing happens in the evening. If you go outside and you see the sunlight dimming and going down, that does help your body to know that it's time to sleep. And it's a chemical process. So it's like we don't want like bright lights on at nighttime. That's why we don't want to be on our phones and on our devices at nighttime, because it interferes with the natural circadian rhythm in our body. So in the morning when you, yeah, look at God, right? In the morning when you wake up, one of the first things that you should do is just go outside and look at the sun. And you don't have to look directly at the sun, but you get that sunlight into the eyes, and it will help your body to do what it needs to do. And try that for a couple of days and see if you can see a difference. And then in the evening time, when the lights go down, you want to use like darker lights. So you don't want to use bright overhead lights. Sometimes people say use a candlelight, like just make it like real calm and peaceful in the evening. Okay. So some of the sleep hygiene things that we can do, we want a cool, dark room. We don't want a bright, you know, hot room. Okay. Don't turn the heat up. We actually want the temperature a little bit cooler, right? So 70, 69, somewhere lower. And that will help the body to prepare for sleep. And then the bedroom should be for sleep and sex only. When we bring in our computers, laptops, we have TVs going on, there's all kinds of stimulation. It's actually not good for sleep. We want to avoid heavy meals. So, 3 hours, try to end your eating, at least 3 hours before bedtime. Same thing for working out. Like we want to exercise, but we don't want to do any hardcore exercise before bedtime because it actually, wakes you up. So you want to give your body like 3 hours before sleep, before you're eating anything heavy or doing any kind of exercise. And then alcohol. People kind of have this idea that alcohol helps you to relax and you get a glass of wine and wind down, but it actually can have the opposite effect. It may make you sleepy, but it also can wake you up in the middle of the night. I don't know if any of you guys noticed that, like now that you're a little bit older, when you drink, it just is not, doesn't work as well. I know for me, like I will wake up a little glass of wine and I'm waking up. So just keep that in mind. It does have that effect. Obviously, yeah, Megan, that's why she stopped. Okay. Yeah. So yeah, alcohol and caffeine, obviously, and chocolate has caffeine in it. So that's why we recommend that for wind down without the chocolate. Okay. And then wind down time really is just about, instead of TV, like maybe reading a book, doing something kind of more calming that is not as stimulating is going to be helpful for you to get to sleep. What's left to enjoy? Oh, girl, there's all kinds of things to enjoy. Yeah. Oh, that's good. I like the yoga wind down. That's good. Yeah. What do you drop in the comments what your wind down is? What are you guys doing for your wind downs? Meditation. Yep. Meditation. Yep. A bath. That's a good one. Yep. I'll do a hypnosis audio. Stretching before bedtime. Okay, great. CBD and or yoga. Okay, cool. All right. So let's talk about magnesium a little bit. I love magnesium. It's a great supplement. It's an element that, is natural. And it's an important aid for muscle relaxation. And so a lot of times I'll recommend 400 to 800 milligrams of magnesium citrate before bedtime. That could be very helpful. Of note, and then magnesium citrate can be helpful for bowel movements too. So if you're suffering from any constipation, it can be helpful for that. There are a number of different types of magnesium. I use one that has a little bit of everything because I want all of these benefits. So the magnesium citrate has digestion. The glycinate is great for sleep. The L-threonate is fantastic for brain health. So that will help with some of the brain fog. And then the sulfate is good for muscle aches and relaxation. If you have any like twitching going on, like sometimes when you're super stressed and that eye starts doing that little thing, it's called a fasciculation. The magnesium can help with that. Let's see. So taking magnesium citrate and then spray or capsules. Are you talking for the magnesium or is that something else you were talking about? With the magnesium, they come in capsules. You can also get a powder. There's a powder version of it. I like that because you can mix it in to water or whatever and drink that before bed. Yeah. Is that what that's called? I'm not sure what that is. Okay. So that, oh yeah, fasciculation probably. Yeah, exactly. Yep. All right. So let's talk about vaginal dryness. Yeah, so the technical term, there's something called the genitourinary syndrome of menopause, and that's basically the changes that happen to the vulva, the outside, and the vagina that occur in menopause due to decreases in the estrogen. And so this can lead to painful sex. Woo! That hurts, and people don't want it, right? It can lead to vaginal burning, um, itching in and around the vagina, and burning with urination. So a lot of women will think that they have a urinary tract infection and they keep coming in and they keep going to their doctor. Their doctor keeps prescribing them, antibiotics, and they may have a urinary tract infection, but it may be because those vaginal tissues, when they get dried out, when they lose their elasticity and they lose their moisture, they're more prone to infections. And so, if we can go ahead and treat that vaginal dryness, we can actually decrease the risk of urinary tract infections and actually decrease the risk of death, because that's one of the leading causes of getting really sick and dying is having those urinary tract infections that can cause sepsis in the body. So like they're very severe. So as we age, we want to keep those vaginal tissues healthy, even if you're not having sex. But in order to prevent urinary tract infections and irritations that can occur. So what are the solutions? Lubricants, vaginal moisturizers, and vaginal estrogen. Now, vaginal estrogen is the tip top, right? This is what you want. And the great thing about it, I mentioned this in our last session, is that just about anyone can use vaginal estrogen, even if you have, cardiovascular disease or history of stroke, you can still use it. You can take vaginal estrogen and the patch. You can use them both together. It's perfectly fine. Sometimes that systemic estrogen, the estrogen patch doesn't quite do the trick. It's not, it's getting the hot flashes, but it's not getting the vaginal dryness. So yes, you can do both of those together. Yeah, I'm going to talk about these lubricants and vaginal moisturizers here a little bit. So for the lubricants, there's three types of There's three types of lubricants. There's water-based lubricants, there's oil-based lubricants, there's silicone, and then there's something called a hybrid lubricant, which is water-based and silicone together. And so the water-based is what most people use, but I feel like the water-based actually tends to dry things out. It doesn't last as long. So it's not great. And when I'm talking about lubricants, this is mainly for intercourse, right? To, make it a little bit more pliable and smooth, right? So the water-based, you can use that. It's safe to use. It's just not, it doesn't last as long, and it kind of dries out, and it kind of can make you actually feel a little bit more dry. So I don't use that as a first line for menopausal women. Oil-based. The oil-based is a really good option too. It's a natural option. It doesn't get like sticky, but it does, it can stain stuff. So that can be a little, not ideal. It can get on your sheets and all that. So you probably want to put a towel down so that you don't have that oil getting on all your good 500 count sheets. Okay, so that's the oil-based. And then the silicone is a really great option. It is also a messy, kind of sticky thing, but it lasts a lot longer. So it does provide a nice layer between your partner and you, and helps to, keep things smooth and not so uncomfortable. So I want to like empower you all to get lube. Like, don't be afraid, don't be shy, get the lube, use it. We have to use what works for us. I had a patient that I saw earlier this week, and she said that she hadn't had sex for like a year because she was embarrassed. She was embarrassed because she was dry. And I said, girl, get you some lube. And I, did prescribe her some vaginal estrogen. But, we need to like be okay with these changes and just find ways to make it work, because you can have a wonderful sex life. You can still enjoy the pleasure. We just have to make some tweaks to make it work. Okay. All right, so vaginal moisturizers. What is a vaginal moisturizer? So vaginal moisturizers generally have hyaluronic acid in them, and what they do is they bring the water into the cells, into the tissues, and it causes the tissues to expand and kind of swell. Think of like one of those little sponges, right? You have those sponges that's flat and then you pour water on it and it expands. That's kind of the idea behind the vaginal moisturizing gel. So Good Clean Love, this is one that I like and recommend to my patients and clients. So you can Google that, over the counter. Vaginal estrogen cream. Now this right here is my jam. Okay, so the vaginal estrogen cream, you can use this. And then somebody asked about estrogen sensitive tumors. Most oncologists will say that yes, you can absolutely use it still because it is absorbed so minimally. It does require prescription. And the guidelines right now still say that you need to have that conversation with the oncologist that you're working with, and your doctor. But most of those oncologists are going to be like, yeah, girl, put it on. It will help you. It is absorbed very minimally into the vagina. And so I'm into the systemic. So it's absorbed in the vagina. And in this case, what it does here is causes the tissue itself to produce it brings blood flow to the area. It causes the tissue to produce its own lubrication. So it's sort of revitalizing that tissue. So instead of, putting something on top of it, like with the lubricant or just bringing water into the tissue, it's actually causing that tissue to start, redoing it what it used to do. So it brings life back to that tissue. So get that estrogen cream. And the way that works is there's like a little inserter that you put the tube onto, and you can push that into the vagina. So you put like a little bit of that in there. And normally, if you haven't been using anything, we recommend that you use it every night for 3 weeks. And then after that, you'll use it as maintenance. So that induction period every night for 3 weeks, and then 2 to 3 times per week thereafter. So not really any side effects, because it's really bringing the pH back to normal in the vagina. Can you use it in conjunction with other creams? You can, like not at the same time. I would probably recommend that you, and what kind of creams actually were you talking about? On the outside? Yeah, I mean, you can use other, internal things on a different day, like lubricants. Yeah. But what you might find is that you may not need the lubricants as much once you start using the vaginal estrogen, because your body's going to be making its own lubricant. So you might use a little touch of it, but, and obviously on those days that you're not using the estrogen, but you'll find that the estrogen actually improves that and you're not going to need it as much. Okay, so vaginal estrogen ring. There is a ring that you can use called estring, and it's a vaginal estrogen that's released very slowly over time. You put it in and it stays in there for 3 months. And then you take it out, throw it out, put a new one in. And it's flexible like that. But that's another form of vaginal estrogen that you can use. I actually like the cream. The cream because it gets into the crevices. You've got the ring, and there's also a tablet that I'll show you here. So it's a tablet that goes in here. And like this, similarly, like the estrogen cream, you use it every day for 2 weeks, and then you space it out to 2 times a week. But the issue that I have with this is that it doesn't get into all the tissues. It sort of sits right here. It works, but I just have a preference for the vaginal estrogen cream because it kind of spreads out and does its thing. Okay. All right. And I think that's it for the slides. Now, I want to talk a little bit about the weight gain. Okay. So I know there's a lot of questions on here about belly fat and weight gain and what's going on with that. And it's really, let me get out of this screen here. It's really related to the way our bodies store fat. And what happens in menopause is the way that the body stores fat changes. And we end up storing what is called visceral fat. So visceral fat is abdominal fat that surrounds the organs of our bodies, like on the inside. So it's around our stomach. There's something called the omentum that hangs over the intestine. And so that has fat on it. And so what happens in menopause is we see that fat change the deposition where the fat is deposited in our bodies, it changes. And so even if you've been working out, you've been, staying on top of things, and then you get this menno belly and it's there and you're like, what? That is the reason why, is because we're seeing this inflammatory fat deposition. And so that can be extremely frustrating, right? So what do we do about it? Let me just give me 1 second here, guys. So yeah, there's a few things that we can do about it. So one of the greatest things is in diet is with fiber. Fiber is going to be very important in helping those bowels to move through. Most women get on average like 10 grams of fiber a day. And we really need more than that. We want to push it to like 25 grams of fiber every day. How are you guys doing with fiber in your diet? Are we getting enough fiber? Let's see some comments in here. Let's see here. Let's see. Anyone? Apple every day for lunch. Good. Increasing estrogen increases breast cancer risk. Thoughts? My doctor. Apple, 4 prunes. Okay, good. Better with my fiber. Oats. Popcorn. Okay, probably not enough. I always know that foods have fiber, not enough fiber. Fiber, yes. Probably need more. Okay. I don't measure it, so no. Okay. Yeah, so one of the things that I tell people to do is eat something green first before you eat anything else. What that's going to do is going to actually help your body to stabilize insulin levels. So when we eat processed carbohydrates and meats, that can shoot the insulin up. It like shoots it up high in like a not so good way, and that's inflammatory. And then the way that your body absorbs the food makes it deposit it in a bad way. So adding that fiber in can be very, very helpful. So things that you could do are something simple like avocado. Do you guys like avocado? Not everybody does. Who likes avocado? Drop avocado. Put avocado in the avocado. Good. Avocado. Love them. Good. Yes. Nope. Angela doesn't. It's a no-go for Angela. Okay. And Jane, no. Love avocado. Okay. Yeah, I like avocado. But it's tricky. Yeah, I understand. Like guacamole, I don't like guacamole, but I'd like avocados. So like sometimes the guac is too mushy, but there's a lot of fiber. You can probably get about a third of your fiber needs from one avocado. So some people I would recommend, and there's good fats in there. It's like really great fats. So if you can stomach the avocado and you like it, that's a great thing to help with that. Also, we want to move, right? So moving your body is a good thing. Oh, before I move on with that, let's just talk about some other things besides avocado. So beans, berries, seeds, nuts, any kind of crunchy vegetable, anything that has some crunch to it is going to have is going to be a great source for fiber. You can also do supplements, but food is always better because the supplements don't have all the other like antioxidants that you'll get in berries, and there's some other really great properties in these things that we're eating. So another little hack is to swap out like the sugary stuff for like dates. It's sugary, but it's natural sugar, and there's lots of fiber in it in dates. So somebody mentioned apples. Apples are great. So swap out an apple instead of whatever sugary thing that you're thinking about eating. Berries, especially raspberries and blackberries, those are also great. Pears, and then when you do eat your apples, eat those with the skin on it because that's going to give you some extra fiber. And prunes, plums. You want to get into those things; those will help. Exercise. So we do want to do exercise, and it doesn't have to be like hardcore, berries boot camp, none of that. Like you just need to do a little walking. Like walking, if you're not moving, start with walking. If you are walking, get a weighted vest or carry some weights with you. If you're already doing that, maybe add some weight training. You need like about 20 minutes of what they call zone 2 exercise. So that's where it's enhanced fat burning. And that's the range where your body is using fat for fuel. So those are great options to keep that belly fat at bay. So those are a few things. And then it's not only important for our how we look, but it's actually that adipose or the fat in that belly, visceral fat. People who have a higher amount of visceral fat are at increased risk for things like type 2 diabetes, hypertension, cardiovascular disease, even osteoarthritis, and sleep apnea. So we want to get that stuff under control so that we can improve our long-term wellness. So, yep. Preferred nuts, walnuts are great. Freezing bread before waiting helps the blood sugar. I have heard that. I don't know about the studies, but that might be true. Let's see what other questions we have in here. Veggies, Trader Joe's. Yeah. Oh yeah, I've had that crunch salad. It's good. You put a little dressing on there and man. Okay, so let's get into some questions. You have mentioned that HRT patch. What is your opinion on the pellet? Okay, yeah, we talked about the pellet the last time, but I'll touch on it again. I'm not a fan of the pellet. The pellet is not FDA approved, right? So I get it in theory. It's a nice idea to just like put that pellet in there, set it and forget it, and you don't have to do anything about it. But the downside of that pellet is number one, they often are compounded. So meaning that it's not just the bioidentical hormones, but they might have the bioidentical hormones and, some other hormones. They might have the horse urine hormones. They might have some other types of hormones, and they're often combined in ways that are not that have not been tested. Sometimes the concentration is too high. And once that pellet is in there, it's in there. There's no way to get it out. And it usually takes 3 to 6 months for your body to, work through it. And so I've had patients where they have, these pellets put in, they feel good for a while, and then maybe they have a complication. They start having bleeding or something. And you can't just you can't stop it. You have to wait it out. Or you have to go in and cut it out, which, it's sometimes hard to find, because it dissolves a little bit. So I'm not a fan. Maybe somewhere down the road when we get some more research on it and they figure out a way to, standardize it, it may be an option, but for now, I am not a fan. Should women supplement testosterone? We don't have studies out on that yet, but it's promising, and we we can use testosterone off label. Testosterone has been used for years for other indications. And so we do have some, case usage on it. What they're recommending, and especially for libido issues, is where I use it with my patients sometimes, is by using it at a lower dose. So we generally use it at 1/10 the dose of what males would use, where a man would use. And then there is some testing that needs to be done to make sure that the levels are not too high. But my opinion is that we can use it. It's a conversation that you have to have, and you have to be able to, work with somebody who prescribes it and feels comfortable with it, because, most people, it's off label. A lot of people don't know how to use it. But I think it's a decent option, especially if you're having, libido issues that are not caused from other things. All right. Did I catch everybody's questions? What other questions do we have?
Earlier there was a question or comment about eye twitching, and maybe some solutions for that would be helpful.
Yeah, so the magnesium would be the solution for the eye twitching, and rest. A lot of times that is a sign that you're dehydrated. So drink some water. Magnesium will help with that, the muscle fasciculation. And then if you're tired, you just lay it down, girl. Take a nap. Get some rest. Okay. Anything else? Okay. Let's drop in the chat. What are you excited about now that we've talked about treatment? What are you interested in? What are you excited about? No, I don't I'm actually not familiar with the magnesium spray for feet. Probably is not, dangerous. I try it. If it works, great. But I'm not familiar with it. What are you all interested in? Is there any treatment that you're interested in? Any treatment that we haven't talked about? Excited about the magnesium? Didn't know about that. Okay, good. How long does the patch last? So you put that patch on for a week. So you put a patch on, stays on for a week, you take it off, throw it away, put on a new patch. In some regimens, and that's just the basic regimens, there's some regimens where you'll do it twice a week, depending on what your dosage is. So most doctors will start at like a 0.25 patch, and then you can tweak it up if it's not enough. Thinking seriously about HRT treatments, but not sure where to start. Well, if you are interested, the Hot Flash Chill system, like I mentioned, has a really good breakdown of all of the treatment options. I wasn't able to get to all of them and into the detail of all of them, but that is an option for you to kind of figure out what will work with you, and also use the hypnosis audios to help while you're figuring out what you want to use. But yeah, definitely have that conversation. And with the hormone replacement therapy, just remember, like, if you don't have any problems with blood clots or bleeding disorders, like hereditary thrombophilias is what they call those. If your heart is healthy and if you don't have breast cancer, you're probably a candidate. Okay. Is there anything about menopause that is different for women who have never given birth? No, I don't. I mean, I think we're going through the same thing. Our ovaries are still shutting down. I never gave birth also. So, and I'm going through it. So, yeah, there isn't really a difference. Hypnosis was amazing for natural and pain-free childbirth. Oh yeah, so I'm interested in hypnosis. Yeah, and as a matter of fact, like the first time I encountered hypnosis, a good friend of mine had her baby, and she was like, I want you there for the delivery. And this is back when I was a resident. And I saw her push that baby out with no anesthesia, and she basically coughed the baby out. not a tear, not a nothing. Yeah. So yes. Let's see. Is there anything about, okay, we talked about that hypnosis. I'm currently taking Vioza. Okay, max dose, but short lasting. So I take at night to get rest. Your thoughts on that drug? Yeah, it's a newer drug, but it's a great option for people who are not, a lot of breast cancer patients can't take hormone therapy. And that one works. It is a it works via the neurotransmitter. It's a neurokinin B is what it's called. And neurokinin B is important in the triggering of hot flashes. So it kind of blocks that trigger. So it's a great option. It's FDA approved. It's new. It's a little more expensive because of its newness, but I think it's a great option for people who are not otherwise candidates. Have you found that it's working well for you? Good. Awesome. Yeah, so I think it's great for us to have these conversations because not everything, there's no one size fits all, and there's little tweaks that we can use. There is actually an estrogen that can be used for people who have higher risk of breast cancer. Um, so, there's lots of different ones. It's not all just the patch, but you've got to talk to somebody who knows about hormone therapy. So yeah. Okay, how do you find hypnosis medical? Uh, I am a hypnosis medical person. I'm a hypnotherapist. Is this something to discuss with your regular doctor? So here, let me put in the chat here. I am a hypnotherapist. The program that I have has hypnosis audios. It's called the Hot Flash Chill system. I will put this in the chat here. You guys can go here and look at this. Here we go. Yeah, so I work with women in a program called the Confident Pleasure Program, which helps women with sexual function. And uses hypnosis and an educational program and work one-on-one with women there. With the Hot Flash Chill system, you can also get a consultation coaching session. And in that coaching session, we spend time going through your particular situation and see what kind of medications might work well for you, what risk factors that you have, all of that stuff. And then along with that, you get the hypnosis audios that you can use at nighttime. And usually those, for most of my clients, they see results in 4 to 6 weeks. So they see after using the hypnosis audios, they can see a significant change in those hot flashes. So me, I'm the person that can do medical hypnosis. You mentioned hypnosis audios. Do you recommend any specific audio programs to start? Yes, the hot flash chill system. What can we do about skin changes and hyperpigmentation? So you probably need to see a dermatologist about the hyperpigmentation. Pigmentation. There are some estrogen creams. I know that there was one recently approved that a topical estrogen cream that we can use for some of the dryness and rebuilding some of the collagen. In terms of the hyperpigmentation, I'm not a skin expert, so I would recommend, checking in with a dermatologist about that. Applied for manufacturer discount, granted 15. What is that? Applied for manufacturer discount, granted 1,500 per year. Not sure. Oh, okay. For Viosa. Okay, awesome. Any tips for increasing? Yes. In our next, I've got lots of tips for increasing sex drive. In our next session, I'm going to really get into sex drive. There are medications for sex drive. But again, that is a biopsychosocial thing. And so that's why I created that program, because we can't just give you a pill. That doesn't usually do the trick. It's not everything. We have to kind of address the biology and the psychology, the physical stuff like the arousal. And we kind of talked about how to get the moisture going in the vagina. But yes, there's a whole, I'm going to leave that for our next session. And that's about quality of life and getting pleasure out of life and how we're going to move forward in menopause and make it like the best. It can really be the best time of our lives. And so we'll talk about that in the next session. Does the hot flash chill hypnosis system work for other things like weight loss or avoiding menopausal weight gain, or primarily for sleep? So it helps with sleep. It doesn't necessarily, I don't have it right now working on weight loss, but that is something that I do with my clients. And so there's definitely things that can help with weight loss in hypnosis, but not specifically for the hot flash chill system. Weight gain, avoiding menopausal weight gain. Okay. Does vitamin D help with menopause? Yeah, vitamin D is one of those things that I actually mentioned that elsewhere, but I didn't mention it today, but is very important. A lot of us are vitamin D deficient, and it is helpful in some of the processes in the brain function. So with brain fog, we want to make sure that the vitamin D, if you get your vitamin D checked, a lot of us will find that it's very low, especially for people who are dark skinned, Black people in general, because we get our vitamin D from the sun and it comes in through our skin. And when you're highly melanated, it doesn't come through as much. So a lot of people who have darker skin have low vitamin D levels and can affect your, energy levels. A lot of people with those deficiencies will feel fatigued and brain fog. So yes, important. All right.
There was an earlier question, is when my mother went through menopause indicative of when I can expect to go through menopause? And do women typically have similar menopausal symptoms to their mothers?
Everyone's different, but I do use that as a gauge. If your family, goes through menopause very late, you're more likely to go through very late. The average age for menopause is age 51, but anything between age 40 and 55 is kind of considered within normal range. At 40, less than 45 is kind of early menopause, and then after 55 is, considered late menopause. Should I be concerned if I'm late to start menopause? No, I don't think so. How late is late? No. Yeah. After 50. No, like I mentioned before, 55 is kind of on the later end, but it's still within normal. Some people menstruate for a long time afterwards. I'll be 55 this year. Yeah. Well, hold on to that estrogen, girl. Are you having any symptoms? Are you having any hot flashes or any kind of symptoms of menopause yet? Yeah, a lot of times in perimenopause, we'll see mood swings and weight gain. Yeah, I mean, I would check in with your doctor. You just want to make sure you're staying up to date on all of your screening. No hot flashes just yet. Okay, good. Yeah, so and then figuring out what will help with those symptoms, and exercise, and kind of getting your body prepped and being ready for it. So you're doing all the right things, it sounds like, based just because you're here. So the exercise you mentioned daily. Yeah, so you ideally, but here's the thing. Most of us are not getting to the gym and doing an hour workout. So start where you are. Like if you're not working out at all, your first goal should be once a week. I'm going to go. I'm just going to get out there. And actually there are studies that show that there's a number of hormones that like affect our well-being. Like dopamine is important, that goes down in menopause, and dopamine is important in our motivation. It makes us want to get up and go and do. And a lot of times that level of dopamine is so low, we don't want to do anything. Okay, we're not trying to go outside. But what we know is that if you make that effort and you you make one trip outside. Like, let's say I'm going to go outside for 5 minutes. The making that goal and you go outside for 5 minutes, even if you're not out there for a long time, that actually propels you further. So it does actually have a feedback loop in the brain that is like a reward. So just having reached a little goal can actually propel you and motivate you to do the next day. So I would say, make your goal to go outside. If you're not doing anything, to go outside for 5 minutes and walk. Like, put your shoes on, go outside. And even if you go outside and just turn back around and come back in, like that, there's something that does to the brain that is motivating and will move you forward. So daily, ideally, but start where you are. Okay. I'm 48 and I just lost 35 pounds from intermittent fasting and light exercise. Awesome. Excellent. Yeah. Intermittent fasting is actually a really powerful way to get to that visceral fat, because once you get to a certain level of fasting, a certain time frame of fasting, then the fat that your body begins to break down is that visceral fat. So kudos to you. I'm a fan of intermittent fasting. You have to know what you're doing. Don't just start fasting. Like there's a lot of, stuff out there about how to do the fast properly. You want to make sure you're getting enough protein in your diet so that you're not burning your, protein up. Like, we need our protein. We want to do it in a way that we maintain the protein and burn the fat. Okay, I do not like working out, but I will walk. Yes, walk. You don't have to work out. Just do something, right? You got to move. So if you don't even feel like walking, just go outside. Like I said, put your shoes on and go outside for a few minutes, and then that will make it easier for you to do it the next time. And Tenny is fasting right now. What hour are you at with your fast? Visceral fat is the devil. Okay. All right. Any last questions? Can we schedule a consult? Yeah, so if you go to that link, I'll drop it in here one more time. One of the options is to upgrade to with a consultation. Okay, 16 to 18 hours. All right, work it out. Make some tea, Tenny. Yes, you absolutely can set up a consultation. I'd be happy to work with you and help you out. I do 20-hour fast and love it. All right. Yes. I lost a lot of weight with fasting myself, so I can appreciate that. Okay, well, I will hand it back to Katina. It is my pleasure. I look forward to everybody next time.
Good evening, everyone. I'm going to hand it over to Sister Tenny to close out the evening.
Thank you, ladies. We enjoyed having you on with us again tonight, discussing the common solutions and issues. Really enjoyed the dialogue in the chat, and we're looking forward to continuing the conversation next week as we talk about living your dream life. Thank you so much. Have a good evening, and we'll see you next week.